There we go. Good afternoon, everybody. Glad to see so many of you joining us on this gorgeous, hopefully end of winter day. As everyone is logging in, for those of you whom I've not had a chance to meet, I'm Dottie Summerfield Justy. I'm president of Summerfield Associates, and it is my joy to be the co-chair of the Small Business Council with Patricia McKinney. And we're going to wait a few more minutes till everybody gets a chance to log in. But Patricia, I'm going to turn it over to you so you can introduce our sponsors.
Hello, thank you so much, Dottie, and hello to everyone. Hopefully everyone had a wonderful Valentine's Day yesterday where you were appreciated and you showed appreciation to those who you care about so much. And speaking of appreciation, yes, we do want to say thank you and we appreciate so very much our sponsors, Independent Bank, as well as United Healthcare. They make these programs possible. So the Small Business Council would not be what it was or is without those sponsors. And first up, we have Heather Wood, who is Vice President and Branch Manager with Independent Bank. Heather, thank you so much for being with us today.
Thank you, Patricia. I want to extend a warm welcome to everyone who has joined us today. I know that our schedules are busy, so I appreciate you choosing to spend the next hour with us. As mentioned, my name is Heather Wood, and I am a branch manager at Independent Bank. When I got the invitation for today's Lunch in the Know, I knew this would be such a relatable topic. Over the last few years, I feel like SEAMS has been on all of our minds. As a banker, I have seen the stress and the anxiety in our customers' faces. I've become a partner and a resource to them as they have walked through these uncertain times. I was able to participate in the PPP loan program that's to help alleviate the pressures that our customers was seeing every day. As a manager, trying to check on our employees' well-being, trying to be supportive to them while juggling my own stressors of staffing, operational challenges, you know it. I'm definitely looking forward to hearing from Dr. Harris on these topics. Thank you again for being here. And if myself or any of my fellow colleagues can be a resource to you or your business, we would love the opportunity to serve you with the same heroic service that we provide our customers today. Thanks again, and hope you have a great rest of your week. And I'm going to turn it back over to Dottie.
And I'm going to jump in before Dottie. We are going to have now Kelly Lowry with United Healthcare. Kelly, thank you so much for being here with us and supporting the Small Business Council.
Absolutely. I find that I learn things on each one of these calls. I'm very excited for the partnership that we're developing between United Healthcare and the Greater Memphis Chamber. We're looking forward to a big product rollout in the next couple of months. You know, at United Healthcare, we know that small business employers want competitive benefits to serve their needs as well as those of their employers. Small business employers have access to big company benefits, and that's what they want. We focus on making it easier to do business with us and allowing business owners to spend their time on what's most important to them, running their business. So that's our focus in the small business area at United Healthcare. I've been with the company for 25 years and primarily in the small business market. So I know how important it is. Today, over 200,000 small business employers trust United Healthcare to help them meet their healthcare needs. So again, super excited about this new partnership with the Greater Memphis Chamber and looking forward to really digging in and making sure that we are meeting the needs of small business employers in the Memphis market. Patricia, I'll turn it back over to you.
Thank you very much, Deborah. And Heather, without you all, as Patricia said, we simply would not be able to do what we do. The other people for whom we would not be able to survive is our think tank. These are our committee members who meet with us on a monthly basis to help plan the programs that those of you who are attending today will see. And we have a few of our think tank members with us today. They've been loyal for 2 years. Michael Detroit at Playhouse on the Square and Catherine Gray from Independent Bank. And I don't see anybody else, but without you all, we simply would not be able to do what we do. I would like to now turn it back over to Patricia, who's going to introduce our speaker today. Thank you.
Thank you, Dottie. Well, we are certainly in for a treat today. Dr. Mekel Harris earned her doctorate from the University of Houston and is a licensed pediatric and family health psychologist and health service provider. She serves as CEO of Harris Psychological Services, LLC. She currently is in private practice in the Mid-South, offering psychological evaluation and support to children, adolescents, and families. Further, she offers training and education, consultative and supervisory services to several local organizations throughout the Mid-South area. Dr. Harris has presented to over 25 domestic and international conferences focused on pediatric, family, and community health issues. In addition, she is a TED Talk speaker, magazine and podcast contributor, and author of a memoir called Relaxing into the Pain, My Journey into Grief and Beyond. And this book is available through Amazon and Barnes & Noble. In her spare time, she enjoys writing, traveling across the globe, and spending time with friends, family, and her feisty beagle. Dr. Harris, the floor is yours. We're looking forward to hearing from you.
Thank you for that wonderful introduction. I always chuckle when my beagle comes up because I think he is so feisty that it's a wonder that I can actually make it to these Zoom meetings. But thank you, Patricia. Thank you, Dottie, Tonja. I would not be here if it wasn't for you all's excellent coordination and just putting things in order for the team. So let me share my screen and then I will wait for a thumbs up from you to let me know that you can see it. And then we'll get started. Okay, can everybody see that pretty well?
You got it, you're good.
Okay, perfect. Well, I'm thrilled today. I always count it a joy when I can connect with the Small Business Council in order to present. And I am so appreciative that you all are keeping this topic of mental health and ironing out your business seams top of mind. It's certainly something that I encounter daily, and I'm looking forward to our conversation. So my best presentations are those where you're interactive. So if there's something that pops up and you have a comment about it, know that it's perfectly fine to turn your camera off, unmute yourself, and ask your question or make your comment. Also, Dottie and Patricia will be manning the chat box. So if you prefer to do it that way, that's fine too. Just feel free to stop me and I'm happy to address any concerns you may have. So today we are going to iron out our business seams. And one thing that I want to start off by saying is that every business, every organization is doing just that. This has been a wonky season that for many of us, we thought it was going to last for a few weeks, maybe a couple of months. Well, almost 2 years into this pandemic, we're seeing that things are still occurring in our society. And so we've got to iron out our business seams. We're going to do this today in a systematic way. So let me get to our agenda. If you're like me, you like to have a roadmap and know where we are going. So I'm going to start off the presentation by really diving into the current state of affairs, right? Providing some statistics that are going to help us really get grounded in what employees are saying and what employers, business owners, organizations are doing. So we'll start with that. Then I want to pose a question to you, and that is, what constitutes a crisis? right? For many of you today, you may be thinking, I'm already at that point. This is a crisis. But I want to give you some things to think about within your organization that will hopefully serve as identifiers or markers for you to know if your organization is indeed facing crisis. Then we'll shift gears and talk about 3 broad organizational practices that I think will help get you thinking and sort of creating a roadmap, a map, if you will, to anchor your organization. Then we're going to dive into our SEAMS, and I'll break these down, each one. And at that point, you'll have an opportunity again to share some of your own personal experiences. We'll wrap things up with some key takeaways. And again, we'll have a dedicated time for Q&A. But again, if you have questions throughout, please feel free to chime in. All right, so let's take a look at this, our current state of affairs. As you all know, or may not know, the workplace and well-being has really shifted over the past 2 years. And we knew prior to the pandemic, you can probably speak for your own organization, that there were work-related stressors, right? This is sort of the norm. But as we've seen over the past 2 years, these numbers, these percentages have continued to creep up, not in a gradual way. They have really shot up to get us where we are now. And so this is from the American Psychological Association. They have been conducting surveys to get a sense of what is happening within the workplace. And these data are from October 2021. What they noticed was that 79% of employees experienced work-related stress. And again, this is not a new statistic, but I do want to give us a bit of a background and context here. Prior to the pandemic, right? So in October or roughly fall 2019, this number was about 48%. So roughly half of employees at that time were experiencing work-related stress. And you can see that this number has shot up quite dramatically. This number is related in part to several things. Number one, just the shifts in environment, right? For folks who were used to working on ground and then having to shift to the virtual space, that created work-related stress. In addition, not being able to have that contact with managers, other staff, and folks in their home office has also been quite startling, as it has been for the community as a whole. So you can understand why this has gone up. Now, when we think about specific symptoms of employees, here's what they were reporting about 4 months ago. 36% of people were naming cognitive weariness, right? Just challenges thinking about the workplace, thinking about the day-to-day, and also managing mentally the challenges of working within the home office, right? Meaning their home, while trying to also maintain their focus on their actual home and family. So cognitive weariness was a pretty prevalent concern. 32% noted emotional exhaustion. And if the cameras were on, I'm sure everyone in the room would raise their hands and note the emotional exhaustion related to showing up in a new way, right? I don't know about you, but at some point in the past 2 years, you've probably experienced a little bit of Zoom fatigue. I'll raise my hand for everybody in the room here because I know that it has definitely been challenging to show up in this way, which for many businesses and organizations is quite foreign. So emotional exhaustion. And then 44% were reporting physical fatigue. Just feeling completely exhausted body-wise, which makes perfect sense. We know that our minds, our bodies, and our spirits are connected. So what happens in the mind tends to manifest or has the propensity to manifest in the body. And then finally, employees in October were noting just increased cynicism. Cynicism not only about the pandemic and sort of the uncertainty related to it, but also cynicism with regard to how the organization or business was handling the aspects and changes as a result of the pandemic. And so these are quite serious statistics that we should always keep in mind. One thing that I think is important, if you have not done this, is to sort of get a heartbeat through survey within your own organization. It may in fact mirror some of this, or it may be drastically different, but that's always important to know as a business owner, what is happening in your own turf, if you will. So those are the statistics with regard to the employee. And when we think about employers, this is recent data. The APA did sort of an extension survey that talked about the employer organizational strategies themselves. And here we are seeing that 86 of employers said mental health, stress, and burnout are a priority. Well, I was happy to see that because it let me know that what employees are saying is mirroring what employers are also concerned about. And again, if you were to look at your own business, you would probably note this. You know that there are concerns and work-related stressors at play. And most of you would argue and assert that mental health, stress, and burnout in your own company is also a priority. Here's where, though, things sort of fell down with regard to businesses nationwide. Only half had a formally articulated well-being strategy for the workplace. And so that's what we're going to talk more deeply about today. Is it's not enough to simply know, Houston, we have a problem. What's important is that we begin to take steps to have a formally outlined well-being strategy for the workforce so that we can see it and respond to the needs of employees. Now, as of January, so just a month ago, only 26% of organizations had adopted a well-being strategy. So again, stark differences. About 90% are saying, yes, we know this is a concern, but roughly a third have actually adopted a well-being strategy. So I want to pause for a minute and get a little bit of conversation here. I would love to know, again, no shame, no condemnation in the space. What is going on in your organization? Have you begun to take those steps to outline a strategy, and then have you begun to adopt and implement the strategy? So unmute yourself for a minute, turn your camera off, and let me know what's happening in your neck of the woods. Feel free to do that. And I'll take just a couple of comments here. Okay, I think, Dottie?
Wish that I could say that we have a strategy, but since we're still remote, my strategy has simply been to try to touch base with everybody individually outside of when we get together.
Yes. Yeah. And that's a great place to start. I'm going to talk about that. Certainly the virtual workspace has created some challenges with regard to implementing strategy. So we'll talk about some creative ways to do that. Thank you. Anyone else have any input about their organization and what you're doing?
They cannot unmute themselves or turn their video on because we are in. So if you all, and I apologize, since we are
type it in the chat box.
Right. Pop it in the chat box, and then Patricia and I will monitor that, or you can text either one of us.
Yes.
Thank you, Matthew.
Okay. Yes, thank you, Matthew. I did not know that you weren't able to turn your camera off. Okay, so if you have thoughts about this, go ahead and just type that in the chat box for me. I just think it's important to sort of take stock of what we're doing and see how this mirrors the national statistics, okay? All right, so let me go on to the next slide, but again, feel free to type that in. So here's what I want you to sort of think about. What constitutes a crisis? Right? It's very difficult. And Dottie, thank you for mentioning this virtual environment. It's really challenging to really get a heartbeat on what's going on when you don't physically see people. And when you do, it's probably so few and far between that it may be challenging to sort of think about what's happening. So what I wanted to do here is get you thinking about your employees and some things that you may want to sort of take note of if you're noticing this in the workplace. The first thing is increased absenteeism. So regardless of the virtual environment, you can probably call to mind perhaps some folks who are calling in sick or not able to participate in a team meeting or seem a little bit more disengaged. So increased absenteeism is one of the first telltale signs of burnout. Okay. Burnout, if we sort of think about what that is conceptually, it is sort of a pulling away from the things, the stressors that overwhelm us, really in order to anchor and ground ourselves. And so absenteeism is a perfect outgrowth of burnout. So one thing I want you to also keep in mind here, and if you have a pen and paper, it may be helpful to sort of jot down the typical stress responses that each of us sort of utilize on a daily basis to survive. You've all heard of the fight or flight, right, response, right? But there's actually sort of a third and a fourth prong that I want you to think of, okay? So the fight part of our stress response happens when in the face of stress, we engage the fight. We are leaning into the fight. And I'll talk about with the signs and symptoms, how that may show up in a moment. Then there's also the flight, right? So increased absenteeism is a stress response in the form of fleeing, stepping away from something that's overwhelming us. So that's flight. Then there's the third prong that you may not be aware of, which is the freezing, the freeze. So these are the folks on the job who may be paralyzed, right? Psychologically, mentally, physically paralyzed to do anything. These may be the folks who, in the face of a project, have a very difficult time coming up with anything to help support the team, not because they're horrible employees, but because their response to stress is simply freezing and not being able to know how to respond. What we want to do is really help folks get to that place. And that's the fourth stress response. That is to engage. So really, when we think about this response style, it's the fight, flight, freeze, engage response. There are 4 responses to this, and engage is what's considered the ideal response to stress in the face of a significant stressor. Okay, so back to the signs and symptoms. Increased absenteeism, as I mentioned, is a form of fleeing from the stressor, as well as turnover, right? So you may have noticed in your business that folks are saying, you know, I'm overwhelmed. I've decided to leave the job and turn in my notice. And you may have noticed a bit of revolving door within your business. This can be a reflection of that flight. What's happening here is so overwhelming that I need to leave and remove myself from it in order to cope. Along the same lines, decreased engagement and participation. So I mentioned this shortly before. Folks may be showing up to Zoom calls with their camera off, right? They may be showing up with the camera on, but as you look out at the screen, there's not a lot of engagement, there's not a lot of participation, and so forth. So decreased engagement can also be either a flight response or sometimes a freeze response in the face of stress. Fourth, you may be noticing that folks are just challenged to keep lines of communication open, right? One of the things that I want you to keep in mind as you think about yourself and your employees is, how is this person responding before the pandemic? This is what I like to call the baseline, right? So each of us had a baseline response before the pandemic. Then it's important to ask the question, how significantly different is their behavior now as compared to the baseline, right? So if a person was sort of disengaged before and you're noticing that they're disengaged still, that may not necessarily constitute a crisis unless it's significantly more disengagement. So just something to keep in mind here with regard to communication. Now, the 5th bullet talks about over engagement, right? And so if you're, as a business owner, you may be thinking, wow, Tom, Susie is really showing up to be present and to engage and to involve themselves in this project, which on the surface looks wonderful. At the same time, I want you to think about your employers, and they may be over engaging as a flight as a fight response, right? The key here is that they're doing it to the exclusion of other people. So I can admit I am a total fighter in the face of stress. And I will know if I'm feeling, if I'm in a crisis state, when I'm over engaging to the point where I'm not inviting other people to the table, right? You may notice as a business owner and leader that you are an over engager. Again, on the surface, this looks fine, but we've really got to think about over engagement without partnering with other people. What that is, again, a fight response, it's really boils down to an attempt to control or manage the stress that's happening internally. But of course, in a business, within an organization, this can be quite problematic. So one thing that I encourage you to do beyond today's presentation is to take a note of your employees and think about where they might fall in this fight, flight, freeze, engage sort of understanding, and start to take stock of where they are. That way you will know, they've shifted, and that could potentially constitute a crisis. I need to reach out to him or her to really talk about what's going on, okay? And then finally, we have those folks on jobs who are outrightly expressing crises. Now, clearly that constitutes a crisis. If someone is saying, not only am I experiencing burnout, not only am I having a hard time showing up on the job, but I'm experiencing suicidal thoughts, for example, or thoughts with regard to other team members that may be problematic, or problems within the home environment that don't seem manageable, that are affecting them in the workplace, then this may be an area that you may need to engage additional resources. So again, type your comments here if you have any questions about the fight, flight, freeze response, and keep this in mind as you consider your employees, because it really can prove valuable in conversations with them. All right, so here are the 3 broad effective organizational practices. And we're going to dive a little bit more deeply into this when I talk about the SEAMS, but there's 3 broad things that I want you to keep in mind as a leader, as a business owner. The first thing is communication. Now you may be thinking, well, Dr. Harris, of course we're communicating, right? But we really want to communicate the strategy. It's not enough to simply put a strategy or a plan of action for wellness in place. It's important that we communicate about the strategy. And this is not a one-time event. This is sort of an ongoing conversation with your team members. Related to this, it's important to adopt a new language. Okay, so I loved when Patricia and I were sort of planning for today. One of them talked about this idea that organizations often talk about, and that is this mantra of let's get back to normal. Let's get back to that. Well, that sounds supportive on the surface. Yes, right? We all want to go back to what we thought we knew prior to the pandemic. But let's think about the subtle message that might create, right? That could be interpreted as a dismissive exercise, right? So let's just get back to normal, guys. Let's just go back to what we've already done. Could be your attempt to communicate and inspire, but could be met with a person who's perceiving that as, oh, this is not a safe place. I can't get back to this place because we're in a place we've never been. So it's not necessarily a getting back to normal. A different way to sort of communicate this is, let's talk about how we might reimagine our organization now, right? That's really what we're all trying to do, is reimagine what it looks like to be in the here and now. So again, to be careful that you are communicating the strategy, but communicating it in a way that is focused on reimagination, not going back, because honestly, we're not going back to the past. We're focusing on the here and now, okay? Second organizational practice is to conduct training. And I really wanted to focus here on the importance of a top, middle, entry level communication. So often, and I can speak from my own personal experiences working in different organizations, there definitely is education and communication in those top tiers. And what we sort of expect is that the top tier will get it, and then that will trickle down to the mid-level all the way down to the entry-level structure of the organization. What happens sometimes is that it's there at the top, and there's a communication, a one-time event in the middle, and then there's sort of a fall off, a drop off in communication. So one of the things that's important within your businesses is to think about a strategic way to be communicating at every single level, so that the entire hierarchy is not only aware of it, but we're training so that the entire culture can shift. This is really important. And in the end, if you have questions about how to do that, we can certainly talk about that. And then finally, something I'm sure all of you are familiar with, which is measuring outcomes. And that ongoing evaluation and strategic follow-up is vital as we're taking stock of mental wellness and well-being in the organization. It's not going to be enough to evaluate and do your survey to find out that most of your people are burned out. Great. That's a starting point. What's going to be important is after you've communicated the strategy, after you've begun to implement some things, that you're circling back on a regular basis to make sure that your outcomes can be measured effectively, okay? And when we get into the SEAMS, I'll talk about how this might show up in your organization. Okay, any comments in the comment box? I wanna make sure, Dottie, Patricia, before I move on. Anything that I'm missing, because I cannot see the chat box.
Dr. Harris, we do have a question if you want
Okay.
to address this.
Perfect.
Do you think sensitivity training should be required for leadership?
Do I think it should be required?
Yes, that's the question. Do you think sensitivity training should be required for leadership?
Okay, so I would love a little bit more clarification about what the person means by sensitivity training. Are we talking about what sort of sensitivity training? So if they can clarify that, I'm happy to answer it.
Okay, and then most of the other comments, and then we'll share the comments about what you had asked, what people are starting to do for their staff about cutting back on hours, more resiliency, time, things like that. So that's just more into what we started with. Thank you.
Okay, yeah. So yes, Patricia, if that person can clarify, I'm happy to circle back and answer that. Absolutely.
Okay, and please put that in the chat to explain that so Dr. Harris can address that. Thank you.
Thank you. Here's what I will say about training as a whole. And again, this is not to be, I'm not communicating this with judgment of any sort. Sometimes as an organization sort of grows, which is a wonderful thing, sometimes there's a misnomer that the more trainings we have on the books, the more we're actually connecting and communicating. That's not necessarily true. It's all about strategic training, right? So my experiences in some of the organizations I've been in is that the trainings are phenomenal, and the trainings are sort of set out in a way to, think about the long term. What's not there is sort of a collaborative communication about the training. So you have people who are sitting in training and the organization sort of checking that off like, yes, I did the training, but there's no follow-up with that. And so what we're stuck with is education alone, which we're going to see in a moment is not enough to really address the full realm of the organizational culture. So that may relate to the sensitivity question, but we'll come back to that.
Dr. Harris, I do have the clarity on that.
Perfect.
So it says how to deal with employees during a crisis such as the pandemic, showing more compassion and empathy.
Yes. Okay. So I do think it's important to, as a leader, as a business owner, to get training yourself as a leader of that organization to know how to effectively do that. And today is part of that. I'm so glad that you're here because I think we'll be able to at least plant some seeds on how to start those conversations. I definitely encourage each of the leaders here today to not consider this training a one-time event. Again, it's going to be important that you are not only learning about it, but that you're circling back and having a collaborative discussion with other leaders so that the sensitivity training is not something that you're just getting from an intellectual level, but you can also implement it effectively. Okay, so thank you for asking that question. All right, so I wanted to introduce, if you have not seen this, these are the dimensions of wellness. And the dimension of wellness, there are 8 sort of variables. In some studies, people will note 6, but it's been expanded to capture 8 areas. And these are all of the things that sort of make up our wellness. So today, as I'm talking about wellness and well-being and these SEAMS, I just want to make sure that you're aware that I'm really talking conceptually about all of them. Now, here's the reality. In an organization, it's very difficult, to know about all of these dimensions of wellness for every single employee. I get that. At the same time, as you're building out your strategies, it's going to be important that you're touching on, if even from a cursory level, all of these. Okay, so how is that person doing occupationally? That's their occupational wellness. Intellectually, are they feeling stimulated in the workplace? Are they feeling stimulated in their environment? Is the environment set up, right, to promote wellness, right? This is something we'll touch on today, is that environmental piece, right? It's not enough to sort of have all the trainings in place within an environment that's not really conducive to safety, right? So we'll focus on that. Financial wellness, right? Well, how are you doing with regard to that in your business? Social, physical, spiritual, all of these things are really important. Now, today, you can see this flashing arrow. We're going to focus on the emotional pieces primarily. However, there's a trickle down because the emotions, mind, body, and spirit are connected. So as we focus on your and your employees' emotional wellness, there will be some spillover into some of these areas, but I definitely wanted to bring this up so that you are, as you're rolling out these strategies, that you're thinking about how you might be able to touch on each of these 8 dimensions of wellness, okay? So with that, let's talk about the SEAMS. This is why you all are here today. You have probably been sitting there going, okay, I get it. Get to the SEAMS. Let me pull out my ironing board and my iron. All right, so today we are going to unpack these SEAMS. And you'll notice this picture on the left, right? Each of you is here because you've probably been racking your brain, having some conversations about how to really show up as an effective business owner, all in the midst of mask mandates and COVID and social distancing still. It's a very complex environment that we are living in. At the same time, I do want you to plug in your iron and know that there are still some things that you can do to help iron out those seams. Now, before I share what the seams are, I want to remind you that every business owner and organization is wrestling to iron out these kinks within the organization. And know that your job is not to iron out with perfection every single wrinkle in the organization. Why? Because that's impossible, right? There will always be wrinkles and things that you cannot iron out. So please go into this top of mind thinking, I need to address sort of the biggest wrinkles, right? I'll share a funny joke here. I grew up in a military family. Both of my parents were in the Air Force. And so you can only imagine, we lived in a meticulous environment, right? We were the only kids, my brothers and I, who were out on a Saturday morning riding bikes at 8 a.m. Why? Because we'd been up since 6:30, ironing out our home seams and addressing things, cleaning and so forth, right? Well, I realized in my teenage years that even though my mom wanted all my shirts ironed perfectly the Sunday before for the rest of the week, I figured out a little trick, especially in the wintertime. I said, you know what? She can see the front of these shirts. So I'm going to focus on the collars and the fronts and the sleeves. And then in the back, if it gets if there's some wrinkles still there, you know what? That's going to be tucked into my pants anyway. I'm going to have a jacket on anyway. So I didn't really focus as much on the back, and she never found out, as far as I know. So I say that silly story just to remind you that there will always be wrinkles, and that's okay. What we can do is focus on those most critical elements and show up as best you can as a business leader. So here are the SEAMS. We're going to talk a little bit about stress, the S, emotion, anxiety, mental health, and then what I like to call survival. And I'll unpack how that term sort of came to be when we get there. But let's dive into the first one here, which is stress. Okay, so you may be sitting there thinking, well, yeah, we're all stressed. We're in the middle of a pandemic, Dr. Harris, and my employees are showing up. Those data said that 86% of people are burned out and exhausted. Okay, what do I do? So what I've done with each of these SEAMS is given you 4 points of consideration, okay? You will hear me sounding like a broken record in a moment as I talk about each of these, but I really want to drive home the importance of each of the points. So in an organization, as a business owner, as you're thinking about stress, one of the critical elements is that you name the reality of the stress, okay? Here's another story. In 2001, I started a job in Houston, Texas at MD Anderson Cancer Center. And I was working with children who were diagnosed with cancer and their families. And it was always interesting to me when working with little kids, so kids under 12, and their parents would say, well, I don't even want them to know they have cancer. Now, of course, these kids were in a cancer facility, but some of the kids really didn't know why they were there because we were sort of told not to share, medical staff and myself, about the kiddos' diagnosis. At the same time, what that did as I'm working with these kids was raise their anxiety through the roof because they had no idea why they were there, but they knew something was wrong because they were in a hospital and they were talking with their friends on the outside and they knew, gosh, why am I here and they're there? So again, a parallel story to name the fact that it's so important to talk about the reality. When we don't do that, what that can do is exacerbate the stress, which seems sort of paradoxical, right? As a leader, you may be thinking, well, I don't want to show up every day talking about stress. I don't want to name this elephant in the room because I don't want to make people stressed out. But it's really the opposite impact when you name the reality by saying something like, yeah, this remains a season of uncertainty in some ways. You're actually lowering the stress with your employee because they can then go, I wasn't the only one thinking that. So I want to just remind you that the acknowledgement really does matter in mitigating and reducing stress. Related to that is communication, right? So dialogue really matters and our languaging really matters. Okay, so I mentioned this comment that I think Patricia made about getting back to normal. That in and of itself can sort of trigger anxiety and stress as the person thinks, I don't know how to do that. That's impossible. We can't go back to that because we're in a season we've never been in. So dialogue language really matters. And an example of this is sometimes we have probably been in organizations where we say things like, well, we're at work now. And when you walk through the doors of this business, I want you to leave your stress at home. This is not the place to deal with what's happening at home. And yes, that's true, right? We don't want to come to work and sort of have so much spillage that we can't function at work. At the same time, with a global pandemic and folks wearing masks and worried about social distancing and communicable disease, it's hard to leave that stress at home, right? So it's perfectly okay to not necessarily throw away the reins, but loosen the reins here because people are showing up to work concerned about catching COVID, spreading COVID, the impact on them, the impact on their family. So it would be sort of comical to completely say, well, we're just going to leave that stress at home, knowing that we're in a season that's very, very different than we were before. Okay, so communication is important. Thirdly, I want to challenge you to focus on how you might be able to implement some anchor points within your organization. Well, what do you mean by that, Dr. Harris? Okay. Each day, as folks are showing up, if we sort of go back to before the pandemic, we sort of had these built-in anchor points. One of them was a lunch break, right? Everybody sort of knows around the 11:30-ish time frame, we're going to close that computer, we're going to close that door, go to the cafeteria, leave the office, go sit in the car. That really served as an anchor point because it helped to ground the employee. They knew, gosh, I have to work 8 to 12 or so, but I know at noon I'm going to get that place to just be, and then that's going to thrust me forward for the rest of the afternoon. Well, the truth is now a lot of folks are virtual. So I want you to think about how might you embed these same anchor points, right? It may be a reminder to your employees that, yes, let's sort of take this moment between this time and that time to still walk away, take a break, call each other. Maybe it's a designated time that we're all on a Zoom just to say, hey, I'm still here. How's your day going for 5 minutes and get off? To really think about that, because in a season where there's so much uncertainty and anxiety, we start to feel overwhelmed. And part of that is because we can't predict. So these anchor points and structure can really serve the organization well if you're creative about embedding those throughout the day, okay? So think about how you might be able to do that in the organization. And again, if you have comments about this, please let me know. Ongoing follow-up. All right, so I'm going to drive this home a million times today, that communication is not a one-time event. We've got to make sure that we're perhaps scheduling roundtable discussions and group brainstorming sessions, especially around wellness, right? What worked in 2020 may not work in 2021 and may not be working now in 2022. So we've always got to be going back and sort of being okay with a mid-course correction. This can only happen if we have ongoing follow-up and check-ins, okay? So these are the 4 things that I want you to be thinking about with regard to stress. Okay, emotion. All right, so you're looking at this top left corner going, she just said that. And yes, I'm saying it again, acknowledgement. We've got to acknowledge how people are feeling, that we have emotions about the pandemic, that it's been challenging for each of us, even for you as the business owner leader, right? We can't heal what we don't reveal, right? You may have heard this saying, and it's absolutely true. We can't really focus on what the concern is if nobody ever says anything about it. And part of what I hope you can do is the second area here, which is lead by example. Guide these conversations by perhaps sharing your own challenges. Now, whenever I present to leaders, I'm often met with, well, how can I do that as a leader? I don't want my team to think that I'm freaking out like everybody else is, right? And I understand that. Certainly as a leader, you have to show up in a way that's poised, in a way that shows that there is strength and grounding on your part. At the same time, what employees are looking for is a recognition that they're not the only ones. And so if you think about this from a hierarchy perspective, if the leader's showing up, always polished, never acknowledging anything's wrong, never acknowledging that they're overwhelmed, never acknowledging, then what may happen inadvertently is that the employees are left with, man, something's really wrong with me. Maybe I'm the one that's really having a huge problem. So then they're afraid to talk to another employee because they think they're the only one. That creates isolation. And in isolation comes more anxiety, more stress, more uncertainty, and perhaps back to that fight, flight, freeze response, more over engaging in a not so healthy way or disengagement, right? So you play a pivotal role in your leadership. And I want to challenge you to think about how you may be showing up to normalize the fact that this is indeed a difficult season that we're walking through. All right, third here is to create an environment of safety, right? Not a punishment for openness. And we've really got to think strategically about what this can look like. We certainly want people to feel safe, right? In the middle of stress and overwhelm, people tend to feel emotionally unsafe. So what are some ways that your business can help people feel safe? And how can we encourage options for safety beyond you, right? Please don't feel like you've got to be the only safe haven. No. What are some other ways that you might be able to engage other peers in your employee assistance program, if you have one, or even beyond the walls of your organization, so that the person feels safe? In just a minute, I'll share some examples of what this might look like to help promote an atmosphere of safety and openness, not punishment. And then fourth, here you see this repeated point, which is ongoing follow-up. Keep the communication flowing. One recommendation that I have here that I always share with leaders is, in your calendar, you are literally putting in there the dates that you're going to follow up, right? You are so busy as a business owner that there's so many cogs that you're having to deal with in this wheel. It's going to be important that you mark down when you're going to circle back, and that your team knows when you're going to circle back. What that does is it creates safety, and it also, back to those anchor points, gives them something to look forward to, which is grounding and anchoring in the point, in the place of overwhelm. Okay, Dottie? Okay.
Just a couple of minutes. We're running. Yeah, I don't want to cut you short, but we'll try to stop at 51, 52 for
Q&A?
Thanks.
Okay, perfect. All right, so I'll run through this. I've already mentioned the acknowledgement piece. So this is really the same. What's not spoken is often magnified here. Again, we talked about some methods of communication. Consider some alternative ways you might do this. This could be in the form of handouts or virtual sort of flyers and so forth. Social media, how can you leverage social media to sort of normalize these SEAMS so that people feel as if they're not alone? And then I'll sort of skip over here to technology. Think about some ways you can have some virtual check-in options with or without the camera, right? I know a lot of times we're wanting people to show up with their camera on, and I understand that. At the same time, sometimes we share our greatest secrets in the dark, laying with our head on a pillow, because it's less threatening. So if you're dealing with someone who is completely over-engaged or disengaged, to think about that camera and to recognize the importance of it or not in the moment. Okay, here I'll just point out in the acknowledgement phase here that, number one, it's okay to be okay, right? There are some folks in your organization who are trucking along well, and they're engaging all of these strategies to help themselves, and it's perfectly okay to be okay. It's also okay to not be okay. And so again, to communicate that in a way that people feel seen and that they know they're not the only ones who may be wrestling. With that, to think about creative ways that you might be able to facilitate connection within the organization, okay? And I would love to hear some of these ideas in a moment. If you are in a business where you have employee assistance, to remind your employees that this is an option so they can benefit from that. And if that's not an option for your business, to think about developing a referral list for community providers so that they can get those things met. All right, so survival. One of the things that is much more talked about, especially with regard to the pandemic, is this idea of post-traumatic growth. So you've heard of post-traumatic stress, right? There are some tools that we can leverage here from post-traumatic growth literature to really think about how we can thrive, not just survive. Survivorship sort of implies that we're getting through, we're prodding along, and we're sort of, doing the minimum. Thriving, though, can occur in a space where we are looking ahead and thinking about what we have in the organization that makes us feel the most grounded. That's where sort of thrivership really happens. This is silly here with the on-site perk, but you may be having a conversation with your employees and you may put some perks associated with being open. The first employee to share about a tough moment they've had this week gets a prize. What that's doing is helping to foster a space of openness, safety, and creativity. So think about how you might be able to do that. All right, so I want to be mindful of time. Just to remind you, workplace stress isn't going, it's not going anywhere soon, right? It's going to be there, and it's okay to name that reality. At the same time, it's going to be critical to communicate some new wellness strategies and communicate with your team about those. Know that implementation helps to destigmatize your employee concerns, not the opposite. Not talking about it actually creates isolation and more stress. Okay, so with that, I want to make sure we have opportunities for some Q&A. So Dottie and Patricia.
I've got one statement, not a Q&A.
Okay.
From Whitney Joe, and I think we all feel this. Thank you, Whitney. You posited it well. I understand the vulnerability aspect, but it's hard to constantly be listening and helping those that you work with, then not feel that you can also have issues. Being strong is important to create the security feeling. But it's also good to remind everyone that bosses, they may not be as strong as you think, and could use your compassion as well.
Yeah. Here's what I'll say about that. So vulnerability is strength. Okay. So this is also critical in the communication, that we be reframing what strength is. Strength is not showing up brown or white knuckling things, acting like nothing's wrong. That's not really strength. Now, societally, we've sort of framed it that way, but that's not actually accurate. It's perfectly okay to show up and say, you know, our organization, this business has faced many challenges, and there are yet still more to come. And as we navigate that, as each of us wrestles with that, here's what we can do to help each other. That's a survivorship statement, because you're acknowledging you're in it with them, right? You're not above them. You're also normalizing the fact that we're all going through this, and yet you're establishing a plan to keep moving forward. So just be mindful of that.
I don't see any more questions. Patricia, would you like to handle wrap up, please, ma'am? And Dr. Harris, when you speak to us, time becomes fluid, and it absolutely dissipates into thin air.
I know.
Oh, thank you so much.
Absolutely. I'll just share my contact information here.
Absolutely. And Dr. Harris, if you have any takeaways that you want our attendees to have, I'll circle back with you a little later to get those and send those.
Thank you. If anybody has any questions or concerns, you're welcome to reach out to me directly. Thank you all.
That's awesome. So Dr. Harris really gave us some really valuable takeaways to make sure that we keep our mental health in check. She also touched on the Employee Assistance Program. As a chamber member, you have access to the Methodist Employee Assistance Program. I will send information follow-up about that. The investment is $1 per employee per month. So that it's definitely worth it to invest in your team. Also, we have a chamber member, Marty with Crestwind. They offer a great resource as well. So he has put that information in the chat. Thank you so much, Marty, for sharing that with about Crestwind Behavioral Health services. That is a chamber member as well. So we know that it is 1 o'clock. We want to make sure that you get your time back. Thank you so much, Dr. Harris. Thank you everyone for sharing your feedback and your questions. Dottie, do you have anything else to add?
If anyone is listening to WKNO at 7:30 tomorrow, we'll be talking with Spark, with City Current, about the Small Business Resiliency Playbook. And one more time, smallbusinessresiliency.com. Everybody take a look and share that. You all helped create the Small Business Resiliency website, and we thank you.
I'll add one thing, Dottie, Patricia. I'll be sharing my slides with Dottie and Patricia right now as soon as we get off, and you're more than welcome to share those with attendees.
Thank you so much. That was a question in the chat, so thank you.
Yes.
All right, thank you everyone, and have
Thank you, everybody. Thank you.
Thank you.